How are you? It's good to see you.
An endocrinologist is someone who specializes in the treatment of glandular and hormonal disorders.
We end up seeing patients with a wide variety of medical conditions, diabetes being a main one, but also we see thyroid patients, bone patients, osteoporosis, adrenal issues, pituitary issues. There's a lot of different things that we see.
All of the other glands interact with one another, so our job as endocrinologists is to look at all of these glands and to see if there is a specific area where the patient needs additional care.
So the goal of an endocrinologist is not just to treat complications of diabetes after they happen, but also to help prevent those complications, therefore keeping patients healthier and happier for the remainder of their lives.
I think if we're going to look at the success of a diabetes model, it's really integrating the primary care physician team, the diabetes educators, the endocrinologist with the patient. Those four components, I think, are essential in the bigger context of treating chronic disease like diabetes, for instance. And so as part of the COPC approach, it's really trying to focus on each part of those working together instead of separately.
Fortunately, being part of COPC, we have access to all of their records. We can see everything that the primary care doctor is doing. We can see notes from other specialists, and then vice versa, they can see everything we're doing.
And so when I use that patient portal, not only is it going to Cheryl and Dr. Krustos, my endocrinologist, but also my primary care physician, as well as my other physicians and specialists that I've reached out to. Because they're all within the network, they're able to see and continue to stay involved in my treatment.
So really we're all on the same page and working towards the same goals for the patient.
You can't just do it with just an endocrinologist. It's not going to work just with my input. We need it all together. And that ultimately leads to the success of our healthcare approach.